2,800 nurses served in the Canadian Army Medical Corps as officers. Canada's nursing sisters saved lives by caring for wounded and sick soldiers. My name is Cadet Corporal Umba from the Royal Canadian Air Cadets 340 Griffin Squadron. At least 51 women with a connection to Bruce County served in the military during the First World War. This is the story of 3 Bruce County nursing sisters. Born on March 21, 1892 in Bradford, Ontario, Luella B. chose a career in nursing. She graduated from Toronto Western Hospital as a nurse in 1916. Luella served 2.5 years with the British and Canadian military as a nursing sister, with a rank of lieutenant. Canada was one of the first of the Allied countries to give nurses relative rank and equal pay to men. She started with the British Queen Alexandra Imperial Military Nursing Sister Reserve in 1916, and a year later she enlisted in the Canadian Army Medical Corps. She was stationed in Malta, Italy, England, and France with No. 13 and No. 3 Canadian General Hospitals and with the Bearwood Convalescent Hospital. Nursing sisters were nicknamed Bluebirds because of their blue uniforms and white veils. They faced many challenging experiences, like sleeping in a tent, sometimes with rats and fleas, shifting to new postings on short notice, and working with limited supplies. Luella returned to Canada after the war in May 1919. On June 22, 1922, she married Dr. James Fraser. He practiced medicine in the Port Elgin, Southampton area for 51 years. Mrs. Fraser lived in Port Elgin, Southampton with her husband for the rest of her life. She was a member of local churches and was active in the Imperial Order Daughters of the Empire, the Port Elgin Legion, and the Canadian Association of Nursing Sisters. She died at the age of 87 on February 21, 1980. Mabel Stauch was born on October 30th, 1893 to a farming family in Saugeen Township. She was the 4th of 5 children. Mabel decided to pursue a career in nursing. With the war raging in Europe and after graduating at the age of 23, she traveled to England. When she arrived in 1916, she joined the British Queen Alexandra Imperial Military Nursing Sister Reserve. On October 17, 1917, she enlisted in the Canadian Expeditionary Force as a nursing sister and was assigned to No. 16 Canadian General Hospital in Metro London. This hospital had more than 1,000 beds for wounded Canadian soldiers. As wounded soldiers arrived, nurses were often the first to meet them. They would give the soldiers pain medication or tetanus vaccines, clean wounds, and offer comfort. Nurses assisted in surgery and cared for wounds by rebandaging injuries. On August 12, 1918, Mabel went to France with No. 1 Canadian General Hospital. In 1919, she returned to work at the large Canadian General Hospital in Metro London. Lucky for her, she got a 14-day leave in February 1919 and got to visit and tour Italy. On June 26, 1919, she boarded the SS Baltic to travel across the ocean to return to Canada. She was discharged on July 9, 1919, and came back home to Port Elgin. She died at the age of 82 on October 8, 1976. Elizabeth Nora Campbell was born on June 28, 1884. Nora attended school in Port Elgin before going to Toronto to begin her nursing training at the Toronto General Hospital. By 1910, she had graduated and was working at that hospital. On April 7, 1915, she decided to enlist in the Canadian Army Medical Corps and served much of her time with the No. 4 Canadian General Hospital Unit. Nora arrived in France in June 1915 and worked in France and England until October. Then she left for the Mediterranean due to violent fighting in northeastern Greece. Nora served in Greece for over a year until December 1916. The soldiers she would have been caring for there were not only suffering from battle injuries, she was also helping soldiers suffering from dysentery, trench fever, pneumonia, and influenza. Some of these illnesses were contagious and life-threatening at that time. They didn't have the antibiotics and other drugs we use today to prevent infections. Unfortunately, Nora was stricken with bacillary dysentery and became very ill. Her condition wasn't improving, so she was taken to Malta. On February 2nd, 1917, she was well enough to return to England. After a period of rest, she was assigned again to the No. 4 Canadian General Hospital, which was using a new civilian hospital in Basingstoke, England. In June 1918, Nora received a second-class Royal Red Cross Military Award at Buckingham Palace. This award was given to nurses who showed exceptional devotion and skill in performing nursing duties over a long period, or who performed an exceptional act of bravery and devotion in their work. After the war, on December 10, 1919, Nora married Dr. John McLeod. They both worked at the Christie Street Military Hospital in Toronto after their marriage. Sadly, Nora passed away at the age of 47 from pneumonia following surgery in March 1932. More than 2,800 Canadian nursing sisters served in the First World War. At least 58 died as a result of enemy-fired disease or drowning on hospital ships. These three women are only some of the many women who showed courageous commitment that many Bruce County families showed, sacrificing and serving, fighting and dying for our freedom. We thank you and we salute you.
Let no tears add to their hardship as the soldiers